An introductory screen says Chalyce story.
I'm Chalyce
A photograph of Chalyce appears on screen.
and have been a foster care advocate for 10 years. With my advocacy experience, I have spoken in front of state and federal entities about my experiences in foster care. Being separated from my siblings, being in kinship care, transitioning out of care, and most recently my experience of not having mental health care while being in care. My mental health story isn't a typical one. I didn't get any of my diagnosis until after I turned 18, aged out of care, and was able to take myself to a doctor. I got diagnosed with anxiety and depression at 18, and PTSD, ADHD, and situational panic attacks at 23. Growing up, mental health wasn't something that was ever talked about in my family. I think that if there had been a mental health screening upon my intern care at 15, I would have known sooner and been able to get the help I needed to have healthy coping skills and tools to help manage my mental health. Trying to navigate how to be an adult after being in care is hard enough, without also having to add the struggle of trying to handle all of my diagnosis. That's why I think having a mental health screening upon entry into care would help prevent young people from falling through the cracks or being over-medicated. Going through care is hard. We shouldn't need to make it harder by not giving every youth every tool they need to succeed in life.
The screen displays the following message. This video was developed by the Capacity Building Center for States under contract number HHSP 23320150071I. Funded by the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services. The opinions expressed do not necessarily reflect the views and policies of the Children's Bureau. The screen displays the Children's Bureau logo and the Capacity Building Center for States logo.